Many people think that as you age, urinary incontinence is a normal part of aging. Many people think that after you have children or go through childbirth. Some people, as far as men go, think, well, I've had a prostate surgery, I should expect to have urinary incontinence, and that's just not true. People often think, oh, I can just buy a pad or a diaper or something at Walmart or Hy-Vee or a store of some sort, and I don't really need to talk to my doctor about it. What are they going to do? However, your doctor can do a lot for you. The doctors can do a lot of medical things, but they can also refer you to physical therapy. Traditionally, physical therapists work with muscles, joints, and bones, and sometimes nerves, and we try to improve people's quality of life. Pelvic floor physical therapists do exactly that. We're just working in a very more personal, discrete region of the body. But as you can see here, I have both the female and the male pelvis here. This red or pink area are all muscles. And so your pelvis is full of muscles that affect your bladder function as well as bowel function. You're looking at the pelvic floor. And the pelvic floor, this is looking at your body as if you were looking between the legs, looking up. This is your spine coming up this direction. But looking here, this is all muscle as well as here. And so as far as difference between male and female, the musculature is fairly similar. A lot of times I hear people say, well, can't I just do Kegel exercises? Won't that just fix? I know what Kegel exercises are. I can just do them. And my answer to them would be, if you know for sure that your pelvic floor is weak and you know for sure that you're doing a Kegel exercise correct, then I suppose you could just do them on your own. Tension can also be carried in your pelvic floor. So if you came to me in physical therapy and you had urinary incontinence and I found that your pelvic floor was tight or tense and I told you to do Kegels, theoretically I could make your problem worse. When rather you should actually do some stretching exercises that we can teach in physical therapy. In addition to exercises for either stretching those tense pelvic floor muscles or strengthening those weak pelvic floor muscles, we can do manual hands-on therapy, which is much more intimate with a patient, but just like you can go and get a massage or something like that, we can address some of those hip musculature and other pelvic musculature with very specialized hands-on techniques in the clinic.